surgical pioneering newsletter and podcast. He argues that with systems like the Da Vinci 5 becoming so common, we have to balance that amazing tech with the irreplaceable, human side of care. So let's break it down. First, think synergy, not substitution. These robots give surgeons actual superpowers, like totally eliminating tremors and providing 360-degree movement. For patients, this means less blood loss and getting home from the hospital way faster. Second, the human touch is still absolutely essential. I mean, all the 3D visuals in the world can't replace a surgeon's judgment and empathy. That's why new robots are adding force feedback, so surgeons can feel what they're doing and really focus on the complex decisions and building patient trust. And finally, training is evolving. The future is a dream team. You've got the surgeon, the robot, and an AI co-pilot. To get there, we're seeing a huge shift towards VR simulations, making sure new surgeons master both the robot and the essential manual skills. So the real innovation here isn't just the machine. It's how it unlocks our human potential for both precision and compassion. Today, we're stepping into the operating room, which, is starting to look a lot more like a high-tech lab. It really is, and you sent over this fantastic stack of sources on robotic surgery, right? And what I found fascinating is they aren't just tech manuals, they really dig into the human side of things. Exactly. The source is correct. The purely technocratic view, we've got hard data, meta-analyses confirming clinical benefits, but also pieces that frame surgery as an act of care and not just manufacturing. And that's our mission today, right? To kind of extract the key findings and find that balance, these incredibly precise machines. But what happens to the human element, the gut feeling? Well, we should probably set the baseline first. This whole shift, it's not just a trend. It's driven by really tangible improvements for the patient. So the data backs it up. Oh, absolutely. The data confirms clinical superiority in a lot of procedures. We're talking less blood loss, shorter hospital stays. I mean, for the person recovering, those are huge concrete wins. Okay, so if the outcomes are better, where's the debate? The robot gives the surgeon this amazing 3D view. It's more ergonomic, but they're sitting at a console, sometimes across the room. And that's the core tension, isn't it? Does that mechanical precision create this physical and maybe even emotional distance that sort of undermines the whole act of care? It's not about if the tools are better. They clearly are. It's about how the tool changes the work itself. Exactly. Okay, let's unpack this. Let's start with the tools themselves, these superpowers they provide. I mean, we've come a long way from the early prototypes, a very long way. Those early machines were, frankly, clunky. But today's systems solve fundamental biological problems. A human hand, even the most skilled one, has limits. You mean like a natural tremor? Exactly. Everyone has a slight tremor. So the first superpower is just tremor elimination. The machine replaces muscle with a motor, and it can hold perfectly still. And that stability allows for the next point, which is just staggering precision. Staggering is the right word. We're talking about manipulating tissue at a level that's just, impossible for an unstabilized hand. And why is that micron level accuracy so important for the patient? What's the direct benefit? It opens up entirely new ways of doing things. Take a prostatectomy. You're navigating this incredibly delicate area, trying to spare these tiny nerve bundles that are crucial for quality of life after surgery. And that's only really possible with that kind of perfect stability. Reliably possible, yes. It links the tech directly to a human outcome. Okay, so you have steadiness, you have precision. What else? Maneuverability. The instruments have 360-degree articulation. Think of it like the difference between operating with chopsticks, which is what old laparoscopic tools felt like, right, and having these tiny, fully articulated wrists that can move in ways a human wrist just can't, deep inside the body. And we can't forget the visual upgrade. It's not just a 3D high-def camera, is it? The sources mentioned augmented reality overlays. Yeah, you're basically giving the surgeon X-ray vision. So what does that mean in practice? They're seeing data layered on top of the live view. Exactly. Imagine you're looking at the surgical site and the system is overlaying, say, the borders of a tumor from a pre-op scan or the exact location of a critical blood vessel. Wow. So the surgeon becomes less of a technician and more of a conductor, processing all these different data streams at once. That's a great way to put it. And it's transformed procedures, complex heart surgeries, delicate microsurgeries, things that used to require massive open incisions are now minimally invasive. Which brings us back to what you said at the start, faster recovery times. It's a really powerful argument for the technology. The machine is just better at the purely mechanical tasks. But are we losing something vital in this quest for mechanical perfection? That brings us to what the machine can't do. Here's where it gets really interesting. Because you're right, the sources all agree that when you strip away the mechanics, the art of surgery is still there. And they define that right, the irreplaceable human part. They do. It's a kind of critical trifecta. Clinical judgment, empathy, and haptic feedback. That's tactile feedback, the sense of touch. Okay, let's start with judgment. That seems like something AI is constantly trying to replicate. What's the difference between a surgeon's judgment and a complex algorithm? The key word is adaptability, or as one source put it, non-algorithmic improvisation. An algorithm is great at following a plan, even a personalized one. But surgery is never that predictable. Never. You run into scar tissue that looks nothing like the MRI, or the patient's vitals suddenly shift. You have to react. You have to improvise based on years of experience. So is that intuition? The pattern recognition from thousands of hours that lets a surgeon know when to deviate from the plan? Precisely. The robot executes the plan. The human saves the day when the plan fails. Okay, so that's judgment. Then there's the third element you mentioned, tactile feedback. This seems like the most obvious thing you lose when the surgeon is at a console. It's the most visceral loss for sure. Surgeons rely on the feel of tissue. How firm is it? Is that a tumor or just scar tissue? Early systems lost all of that. And that was a huge criticism from surgeons, right? That they couldn't feel what they were doing anymore. A major critique. So much so that the industry had to respond directly. And how did they do that? With something called force feedback. Newer systems like the Vinci 5 have it. They're trying to digitize the sense of touch. So the console pushes back. It gives you a synthetic feeling of resistance. That's it. The system sensors measure the tension on the instruments and translate that into a physical resistance the surgeon feels in their hands. It lets them know if they're pulling too hard on delicate tissue. So you get a digital sense of touch. That's fascinating. But even with that, you're still left with empathy. And no one is programming that. The sources are pretty clear that the psychological comfort, the trust, that whole patient-surgeon bond, that's still crucial for healing, and only a human can provide it. Which suggests the future isn't about replacing the human at all. It's about refining their role. Exactly. The consensus is that the future is synergy. We have to get away from this robot versus human idea. It's a team, a symbiotic team. The machine handles the repetitive precision tasks, the suturing, the holding, things that cause fatigue, and that frees up the surgeon's mental energy to focus on what only they can do. The complex decisions, the improvisation, and the communication with the patient and the team. This is the surgical dream team of the future. The surgeon is the leader, leveraging these incredible tools. And the sources say they'll have another teammate too. Artificial intelligence, a sophisticated co-pilot. Okay, but what does an AI co-pilot actually do in the OR? Is it just reading a chart? No. Think of it as the ultimate second set of eyes. It can analyze the live video feed and say, flag a potential hemorrhage milliseconds before a human eye would catch it. So it's providing real-time risk assessment and suggesting optimal pathways based on that specific patient's anatomy. It's a true partner in the procedure, which means the training for surgeons has to completely change. You're mastering two different skill sets now. You have to. You need the manual dexterity and the advanced robotic control. And to do that safely, the sources all point to virtual reality training simulations, the flight simulator for the operating room. It's the perfect analogy. You can practice these incredibly complex scenarios, including all the unexpected complications we talked about, without any risk to a patient. It makes the tech much more accessible. If we connect this to the bigger picture, as powerful as this all is, we have to talk about the ethical questions. The tech is moving so fast, and the governance is struggling to keep pace. The sources point to three big ethical pillars that need, urgent attention. Okay, what's the first one? Equitable access. These systems are incredibly expensive, so you risk creating a two-tiered system. The best care is only for people in rich cities or with the best insurance. It's a serious danger of widening healthcare disparities. The second is data privacy. This is a hyper-connected environment. You have video, AI insights, vitals, all being networked and stored. Who owns that data? And how do you protect it? Huge questions of liability and security. And the third pillar, which we've touched on, is autonomy. How much control do we actually hand over to the machine? Where do we draw the line that a human surgeon must never, ever cross? Right. It's the ultimate accountability question. If an AI suggestion leads to a complication, who's responsible? The surgeon, the manufacturer, the programmer. That's a boundary we have to define legally and ethically before the tech gets even further ahead of us. We have to. So what does this all mean for the person who might actually be on that operating table one day? I think it means that robotics is ultimately about empowering the surgeon. It gives them abilities they never had before, which leads to better, cleaner operations and faster recoveries. But the core role, the judgment, the leadership, the empathy, that remains fundamentally irreplaceable. The machine is an instrument, an incredible one, but the human is still the leader. As we close out, one of the sources had a phrase that really stuck with me. It said that surgical programs now have to teach robotic bedside manner. It's a fascinating concept, isn't it? It acknowledges that physical distance and forces you to be more intentional about communication. The moments before and after the surgery become even more critical for building trust. And that leaves us with a final provocative thought for you to think about. In an era where the surgeon is sitting behind a technological buffer, what specific actions beyond just the usual pre-op chat actually define a compassionate and reassuring robotic bedside manner? What new forms does human empathy have to take when it's delivered through a console? Something to think about, definitely. Think about that, and we'll catch you next time for the next deep dive. This was based on a profound review by Dr. Reza Lankarani of the Genesis Journal of Surgery and Medicine. For more details, check out the Surgical Pioneering podcast series application at surgicalpioneer.kodiaks.me.